So we're going to cover, first of all, I know that Diane's going to talk more about this, but just the kidney and what can go wrong with the kidney. The thing that we dread most as clinicians with an interest in scleroderma is that some people, as has been mentioned this morning, develop a condition called scleroderma renal crisis. And we know a lot, and I think one of the huge advances in the last few years has been the recognition of who is at most risk. And they're the patients, as we heard earlier this morning, with early disease and diffuse disease. Although, occasionally other patients can get them too, but mainly accelerated hypertension, as it's sometimes called, or scleroderma renal crisis, happen early on in the disease, and then people with what we call the diffuse cutaneous subtype. That means that the skin involves not just the hands and the feet, but higher up to what we call the proximal limbs, the thighs or the upper arms or the trunk. And these are the people who are most likely to get a scleroderma renal crisis. And the blood pressure can rise very suddenly, and so we need to watch out for it, because it is a treatable thing, but we need to get it early. And because of this, as we said earlier today, we advise people to very regular blood pressure monitoring, preferably if people are happy to monitor their blood pressure at home so that you can check any rise. And it's important if you develop any new symptoms, for example, headaches, sudden onset of breathlessness, that these of course may have other causes, but if you get anything that's unusual, then especially if you're in one of these high-risk groups, with the early disease or the diffuse disease, straight off to get your blood pressure checked, and if it's high, then you will need to come into hospital to have that sorted out.